Oh, live. Hello,
Okay.
everyone.
Hello.
We are live then.
Yeah, after 10
Hi,
days.
Mr. Ben.
Yes. Hello.
Yes,
Hello,
because
Su
it's
Hui.
changed our schedule to every Saturday already to reach more people.
Yes, and we know now it's RMCO actually. So more
Yeah,
people
many
start to
people go
work.
back.
So yeah, they cannot catch us on weekday.
Yes.
That's why we
That's why we
change to
changed it to
Saturday lor.
Saturday.
Yes.
Yeah, so
So
today, Mr. Ben, we talk about the outer wrist pain.
yes.
The
Yes,
thumb
outer
pain.
wrist pain.
Yes.
Yep. Actually, outer wrist
So,
pain. We use the word outer wrist pain because people don't know that it is a thumb pain. Everyone thought it's a wrist pain. That's why we use the word outer wrist pain, but actually it's a thumb. It more refers to the thumb.
and we have.
So you let me know lah, Shu Hui.
Yep. Yep.
If
So,
you want to start, yes.
Actually, today we have. Where's Ken? Actually, he's at backstage helping us.
Yeah.
Today.
Yeah, he's hiding.
That's why. Okay.
Okay, so last visit, last live, which was about 10 days ago, right? We talk about carpal tunnel.
Yes. Carpal tunnel, also a very
So
common.
today we're going to talk about
syndrome.
near carpal tunnel. Yes. Yes, but today we talk about near to the carpal tunnel, but it's more to the wrist area or the thumb area. Oh. So shall we start?
Sure.
Okay. Yep. So okay. Outer wrist pain. Today's title, outer wrist pain, or another word we call it Wadsett syndrome. Okay. So it refers to pain around the thumb area. So okay, for those participants or audience today. So basically, if you look at this slide, right? We are having we do have a team now. The team now is we call it women's health. Okay, women's health, but it doesn't mean that you must be pregnant, then only you can come. As long as you're a woman, you can come. Husband come or not? Husband can come and see or not.
Of
So
course.
yes, okay, ladies, this is where you catch your husband and pull them in here. Okay, because we're going to teach the husbands, okay, how to do, okay, for your ladies, for your wife, for your mom. Okay, so now in this women's health, we're going to talk about we are going to talk about a few big titles. Today, number one is the quervain, which is the outer wrist pain. All right, we also will touch up some incontinence. Okay, which is next week, and then we will talk about some postural change, low back pain, sciatica. All right, and we also will talk about leg cramp. So all these are common seen problems in human, especially women, but human more.
Yes.
Okay, so so there's one say, if men got thumb pain, okay, yeah, men also can got thumb pain. Okay, later we will show you why. We already do the analysis. We know already why men got thumb pain. Okay, so today basically we'll talk about something called quervain. Quervain in medicals is a medical word, quervain syndrome. All right, but quervain reflects to thumb pain. You talk about thumb pain. Okay, if you look at the photo, okay, quervain syndrome, normally they have difficulty to show light, to give me light. All right, so if you can't give me light here, you can just click on your computer. All right, so thumb pain, normally they come with, they can't give us a light. So they will tell you, oh, I have pain when I try to lift up. Okay, I can only lift up halfway. Sengit, can see my hand, right? I can only lift up sengit, something like this. All right, you can't give up. This is light. This is half light. Okay, so those who are with thumb pain, normally they will have problem. They cannot give you a full light. Full light. They can only give you half light. Okay. Yeah. Okay. So this is our topic today.
For the and even also for the quervain syndrome, is very, very hard to people to memorize it. That's why there's a Wadsett syndrome. There are many names for this thumb problems.
Yes. Thanks, Shu Hui. Yes. All right. So this the quervain, we also call it Wadsett syndrome. So today in our slide, we will use the word Wadsett syndrome. Everyone understand? Everyone know what is Wadsett, isn't it? Okay. So we will use the word Wadsett syndrome. Okay, which indicating thumb. Yes. All right. And or another way you can call it mother's thumb. Okay, mother's thumb. All right. So next. Okay. So generally, Wadsett syndrome. So what is Wadsett syndrome? So what is it? So Wasset syndrome, right, is a inflammation around this thumb area. All right, around this thumb area. So you look at my thumb, right? My thumb, this thumb. All right, around this area. Okay, generally, this is what we call Wasset syndrome. All right, so people present with around the wrist and it's along the thumb. Around the wrist, along the thumb. This is what we call Wasset syndrome. Okay. So actually, it's because of inflammation. As usual, when there's a pain, why? It's inflammation, swelling, warm. Okay, that's why normally if you see an orthopedic, they will give you anti-inflammatory. Either it's an oral one or it's a topical one whereby you put on it. Okay, and remember, the location is very important. The location is at the outer of the wrist, which is along your thumb. Yeah. Oh, okay. Yep. So remember, this is a thumb pain or Wasset syndrome.
Yes.
Yep. Next.
Yeah, actually, right. Since it's a wrist thumb problem, actually, but a lot of people actually mistaken it as a diagnosis is a wrist pain.
Wrist pain. Yes.
Yeah.
So even some of our mothers' patients, right, when they text us, hey, I have wrist pain. Hey, I twisted my wrist. Okay, can I come? So when they came, right, we assess, oh, actually it's not a wrist. Okay, actually it's a thumb. Okay, because the reason very simple. If you look at the symptoms here, right, because the bone pain, right, at the outer wrist, it feels like at the bone area, your bone area. Okay, that's why very commonly mistaken as a wrist pain. And then normally it happens in a very sudden onset. Sudden onset means suddenly. Today Shuhei no pain. Tomorrow morning wake up, how come my thumb cannot light already? We call it sudden onset. Right? Then you feel a bit warm, tender. Tender means when you press, a bit painful. And then sometimes you may see some swell. Yeah. Okay. All these are indicating more acute inflammation. All right, acute inflammation.
But Mr. Ben,
yeah.
So it will be worse in the morning or after a break, right? But
yes.
Why some people, right? They say when the more I move, the better the thumb they feel. The symptom will be lesser. Is it true?
So that is the myth. That is a wrong myth or wrong understanding. Okay, now yes, Shuhui, a lot of people having the worst in the morning. The moment they wake up, when they try to move the thumb out, that's the most painful one. All right, or after a break. Yeah. Yes, after a break means what? Okay, so now I have a break, I have some coffee. All right, when I try to get something, suddenly I have a pain again. So after a rest, yeah. All right, so, but what you said was correct. The pain decreased, okay? The pain was become better as they move. All right, so they thought, then that means what? I should move more, right? This is a normal myth. All right, so actually it's not true. Because as we say, this is an inflammation. Inflammation will cause adhesion at the bone area, or at this bone area, adhesion, glue. So the more you move, you break the adhesion. But at the same time, you are creating more inflammation.
More inflammation.
All right. Now, the more you move, the thumb you feel better. No right, no wrong. Now, but trust me. Next morning you feel it the worst. Next morning. All right. So again, my message here is, it doesn't mean that the more you move, the better you are. You should continue to move more. The message is, okay? So you have to rest, okay? Take care of the tendon. Because why? Tomorrow morning you will suffer. Yeah, okay? So this is the typical symptoms of acute inflammation. Okay, so and normally those clients who have these kind of symptoms, right, we may also advise for some anti-inflammatory drug already. Yeah, okay, for faster or better effect. Okay.
Yeah. So the inflammation is also caused by the overuse, right? So I
think
it's quite
overuse,
very common.
wear and tear. Very common. Yeah. Very common.
Yeah. Because the thumb is our main finger, right?
Digits. Yes, main digits where insurance pay the most. Yes, where insurance pay the most when you lost your thumb. You lost your index finger, pay a little bit, lost your second finger a little bit, lost your third finger, fourth finger a little bit. But if you lost your thumb, they pay you the most. Because very important. Yes. Okay? Yep. So this is the common symptoms.
Yep. So those who have the symptoms, or your friends having a symptom, use the thumb a lot one, those gaming, texting one, do share to them. Yeah, tag them, share to them. Okay, it's not just for women. Yep.
Okay, so So here we will talk about what are the common mistaken diagnoses. So, okay, if it's around the thumb side as we said, it's more to the quervain or the WhatsApp syndrome. But sometimes it could be also ligament injury. All right, this is where your physician, your doctor, or your physio has to be able to tell you, is it having a ligament injury or is it having a quervain or WhatsApp syndrome? All right, first common mistaken diagnosis. Now, second mistaken diagnosis is pain around the little joint, little finger. That's how we were saying, yeah, WhatsApp syndrome should be along the thumb. Should be along the thumb, there, along the thumb. All right, but another one, if along the little finger, we call it TFCC. Okay, it's the complex. I also don't know what's the full name. Okay, but it's a complex. It's a complex condition. Okay, along the little finger, but we're not going to talk about it a lot today. Yes, it's also touching about the ligament. All right, now there's another common wrist pain, which is around the wrist. We call it central wrist. This is very common one, especially ladies who always do yoga, Pilates, whereby they need to put their hand into this angle onto the floor, or when they do like this, they felt the pain at the wrist. Yeah, so this is another common problem, which is not the thumb, totally the thumb. Yeah. Okay.
You meant to say that these three conditions are different diagnosis, but it's not related to the thumb condition. Right?
Yes. Yes, you are right. Yes. Okay. So of course, if you have all these three things, can you see physio? You still can come and see us. Why not? Yes. Yes. Okay. Expertise of a physio is able to find out what's wrong with you. Okay. Only when you manage to find out what's wrong with you, then only we can treat you. Yes.
Yep.
Okay.
Okay.
So, okay, next.
WhatsApp
okay,
syndrome.
Right. WhatsApp syndrome. So how we explain what cause WhatsApp syndrome? Okay, so actually it's basically it's due to your thumb problem. It's your thumb tightness, thumb muscle. Where's your thumb? Thumb is around here. Where was your pain just now? Outside, right? Outer. But the biggest problem is because of your thumb side. All right. Actually, if you look at your thumb, I call it what, there's a drumstick. There's a drumstick here. Can you see my drumstick here?
Drumstick.
Yes. This is a small drumstick. It's too big already. This is going to give me problem. Okay. So this drumstick is going to give you problem at the outer surface of your thumb. So in other words, if you come in with outer surface or outer pain, the treatment should not focus here. Where's the culprit? Your little drumstick. Drumstick is your problem. Okay, so if you go back to our slide. So who caused the thumb tightness? Daily activities. So that's why today we ask all the ladies to come and see here, right? Okay, sorry, yeah. So I assume that most ladies do the house chores. Guys are all tabule one. Okay, so a lot of house chores, a lot of rinsing, a lot of squeezing, a lot of washing, gripping, a lot of thumb usage. Okay, so a lot of house chores. Okay, that causes the thumb to overuse. Power grip of thumb. Some people use a lot of thumb for grip purpose. Okay, they need thumb a lot to use the work. For example, stapler. Some people's work is meant to stapler. Yeah, also all this can cause the thumb pain. Okay. And then game. Okay, now you see, go back to the first point. We say ladies do house chores, right? So where the guys go? They are doing the gaming. Okay, as my picture here, game, PS4, handphone. All right, handphone nowadays, right? When you use handphone, it's a lot of thumb usage, isn't it? It's a thumb TPS. Yeah. All right, and then pregnant. Okay, why I say pregnant lady? Pregnant or after delivery. Do you all see the small photo? The small photo on top there, the milk pump.
The milk pump, right?
Yes, the milk pump. So now you see some some post delivery lady, right? They use hand to pump the milk. Okay, when you use your hand to pump the milk, where is your force come from? It's all at your thumb. Okay, that's why a lot of ladies who milk manually, they suffer thumb pain. Okay, so this is why we mentioned women's health today. because it happens in many ladies after delivery, and they cannot take medication. Correct or not? Yeah, because if you take medication, medication go to your breast milk. So they are trying to avoid all these things. Yeah, so they have to suffer this. So you guess, suffer this for how long? Until you don't need to feed your baby. Until you don't need to feed your baby.
That's very painful.
Yeah, okay. So you have to feed your baby for 1 year. Yes. Okay. And then chef. So what I say chef. Chef, one hand holding, okay, another hand holding the whole wok. Very heavy one. So again, it's a power grip of the thumb. All right, and then also a loose grip of the racket, golf club. That's why golfers, if you notice, their left hand is wearing glove one. One of the reasons also try to improve their power grip. All right, so that they also overuse their left thumb. Yeah, this one happens in golfers. Okay, and lastly, repetitive thumb movements. WhatsApp lor. Some people like to use WhatsApp. Okay, those who drive, halfway driving and halfway WhatsApp one. Yeah, a lot of thumb usage. All right, and one more, air cruise. Air cruise. Do you notice before aeroplane depart, right? What does air crew do? They will count people, right? They will count. How do they count? 1, 2, 3, 4, 5, 6. Yes, all these are repetitive thumb movements, and they easily have thumb pain. Okay, so audience, if you have friends who are air stewardess, tag them. This is for them.
Yep.
Okay, this slide is for them. Okay, so actually generally in a nutshell, right, there are so many activities in our day, right, involve our thumb. Okay, so therefore thumb pain is so common, and therefore after thumb pain you suffer a lot. Yes. Okay, so I think there's a question.
So
what is the drumstick pain? Okay, sorry, you summarize first. You summarize first.
Just to summarize, right? All the daily activities is all related to the gripping,
yes.
and the usage. Even for tailors, they're using the scissors. So that's why there's a lot of names come out.
You're right.
It's not only WhatsApp syndrome. Yes, BlackBerry syndrome,
yes,
texting syndrome, gaming syndrome. There's a lot of syndromes all relates to the thumb pain. Yep.
Yes, you're right.
So yeah, there's actually someone asked, what if drumstick pain?
Drumstick pain. So drumstick, this is drumstick. Wait, I put our photo here. This is drumstick. Okay, this is drumstick. Now, normally we say drumstick cause outer thumb pain. So I think the patient was asking, the client was asking, what if drumstick pain? Now, if you're having pain here, okay, if you're having pain here, that means what? Your work or your daily routine is overworking on this muscle. Okay, so probably you fall under all these categories. Okay, these categories. So you have to check your daily routine. Does it involve all these things? If yes, you have to find out way already. All right, stay until behind. We'll teach you how to loosen this muscle. Yep. Okay,
Your self-help tips.
Yes, your self-help. Okay, so I think we don't wait until the end, right? We will throw a question now, right?
Yep.
Okay, so lucky draw question. Okay, we try to draw early so that everyone got the time to find the answer. Okay, so what is the another or other common name for the quervain syndrome? Okay, what is the other name or other common name for the quervain syndrome? Okay?
Any name.
Yes, any name. All right, it could be mother's thumb, WhatsApp syndrome. What else? BlackBerry syndrome.
Gaming, BlackBerry.
Yes. Okay. All right.
Yep.
So
and before that, remember to track 3 friends. Okay, 3 friends.
Yeah, 3 friends.
Yes, important thing must say.
Yes.
So we are giving out a free physio session also, right, Mr. Ben?
Yes. So this round, the free session will be a free physio session. Yep. Okay. Good. All right. So let's proceed. So now I want to know if I'm having WhatsApp syndrome, right? So how can I check? Now, test number one. Now, if you all can look at the picture, right? So test number 1 is you hold your thumb, hold your thumb. I have to show your thumb. I hold your thumb inside your 4 fingers. Okay, inside your 4 fingers. Okay, as a picture number 1. And then slowly bring your wrist downward. Bring your wrist downward. Okay, so I hold, and I bring the wrist downward. So now, as you try to bring your wrist down, ow, there's a pain.
Ouch.
All right, so that is WhatsApp syndrome. Positive. Congratulations. You have WhatsApp syndrome positive. All right. So if first test very sensitive. Okay, again, if you too sharp pain, do it slowly. Hold the thumb in the 4 fingers and slowly bring the thumb downward. All right, you should feel some pain at the outer along the thumb. Sharp pain, it should be a sharp pain. Okay, so this is the test number 1. If you have it, congratulations. You don't need to do other tests already. It's quite positive. Okay, now if you do this, if you feel like, maybe yes, maybe no, good. All right, you are half there. So, okay, let's do the second test. So, second test, what you do is just what did I say? You can't do a good like, isn't it? You cannot like your friend. Correct or not? You cannot like Facebook. You cannot like your friend. So, what can you, okay, how to test? So, now basically, your thumb upward, right? But you put a force there. And you try to push your thumb against the force. Okay, push, you try to do the light, but you try to use another force, outer force, to fight against your thumb and see if you can trigger or reproduce any pain or not. If there's a pain, so what happened, Shuhei? If there's a pain,
Then there's
congratulations again. So it is a WhatsApp syndrome. Okay, congratulations, you are having a mother's thumb. You may not be a mother, but you still can have mother's thumb, right? So possible for a guy to get mother's thumb? Possible.
yes.
Too much of game. Okay? And normally chef is a guy, isn't it? Normally chef are guy, isn't it?
Yes.
Yeah, so guy also can get. Because we say chef over on the thumb, you can get. Okay? Barber? Okay, also can get. Yes. Alright, so this is a 2 tests. Okay? And before we proceed to the third test, someone is saying, oh, my left one is painful. Okay lah, so that one shouldn't you as WhatsApp too much. And then got one, I couldn't straighten my right thumb. Okay, so that is painful lah. So all these are showing positive tests. All right, so then we have the third test.
Yep. So they all should have tag 3 friends. Yep.
Yes.
And win.
And try to win
the free physio session. Yeah.
Yes. Okay. Now third test. How do I know if my thumb's muscles are very tight? Just how we say, the earlier 2 is to test the pain. Now we were saying what? Who caused the pain? It's your drumstick. Your drumstick. So now, how do I know if my drumstick is problem? Very simple. Open your palm. If you see you have a very nice shape here, it's also quite confirmed already. It's positive. All right. Your thumb is going to give you pain. Okay. Your thumb is going to give you pain. All right. Or another way is to what you say. Extend your thumb downward. You can try to extend your thumb downward and see if you can feel a lot of pulling around here. Because you're trying to stretch the thumb. If you do feel the pulling, that means it's an early sign. Oh, there's an early sign. Early sign of any thumb problem. Okay, I can't tell you early sign of what, but early sign of any thumb problem. Okay? Yep.
Okay.
So, yes. All right, so we just finished our way to test mother's thumb. Okay? So next, everyone wants to know, right? So now, I got thumb. I'm positive. You congratulate me. So what are the treatments? So okay, so treatments include medically, so we will not touch much, which normally they will apply medication, okay, anti-inflammatory medication, or sometimes injection, okay, injection onto the pain area, or sometimes worst come to worst, surgical release. They will by surgery to loosen this inflammation. All right, but again, I always encourage try conservative first. Try conservative, whereby physio first before next step. All right, because sometimes all this is a muscular problem and it's reversible. Or they are all reversible. Okay. So what I'm going to share is, before I need to share.
Yeah, but before,
yes,
before you go to the conventional physio treatment, yeah. Okay, so just to tell everyone, because a lot of people during this RMCO, they are still afraid of coming out of the house. Yes, because of the COVID-19. Yes. So we are introducing a new service, okay? Online consultation with Mr. Ben.
Yes.
Yes.
Yeah, with me.
You can go through
Yes, okay.
Skype or Zoom.
Yes. Yep. Okay. Yeah. So this online consultation is we go through Skype and Zoom. So from the Skype, we take your history, or we call it subjective history, your problems, and then from there we tell you what's wrong with you. Yeah, we assess you from screen, then we diagnose you, and then we teach you some home exercise program. Yes. Okay. So who needs us? You can go to our website, or you can go to our Facebook to get our phone number. Okay. Then you you can contact us from there. Okay.
Yep.
Okay.
You can PM us
and
book your appointment also. Yeah.
Yes. So advertisement done.
Okay. So usually,
Treatment.
what is the conventional physiotherapy treatment? From what I know is that a lot of strengthening they will do for our gripping and also for our wrist.
Yes. Okay. So there'll be a lot of exercise on your grip and your thumb. So now over here, we do not say that they are wrong. All right, but over here we will look in that another way perspective. Look at another perspective. So what is another perspective? Is your drumstick problem. We'll rather look into your drumstick problem first instead of straight away get you to do a lot of exercise. Okay, to strengthen, so-called strengthen the thumb, or straight away direct treatment onto your inflamed tendon. All right, we'll look into your drumstick first. Okay, because we believe and we have testified that drumstick is the biggest problem. It's the biggest cause. Yeah, okay, it's the very biggest cause. All right, okay. So Shuhui, a lot of people will ask, today sudden onset, I got a pain this morning. Can I come to see physio now?
Yes, you should.
Yes, okay. Yes,
so that
you
we
should.
can do something about it before it further
get worse. Yes, before it gets worse. Okay, and again, if treatment works well, diagnosis do well, correct, precise, immediately after treatment, you should see the difference. Okay, so over here, some simple suggestion. What can you do during day one? The day one, the goal is basically very simple: to reduce your inflammation. Okay, to reduce the inflammation. So now, ideally, thumb pain heal within 2 to 4 weeks. Okay, ideally. But if you do it well, it can heal within 10 to 14 days, within 2 weeks' time. Okay, so first, rest. Rest doesn't mean that ask you to go and resign. Okay, rest doesn't mean ask you to go and resign. Rest means if you are playing game, rest from a game. If you are activities, 1, 2, 3, 4, 5, 6, counting, rest. What can I rest? Change another thumb. All right, this is what we call rest. And then ice pack, very frequent ice pack.
Mr. Ben, the rest?
Yes. Yes, the rest.
Yep, yes. The rest is including, we can buy like the pica, right?
Oh yes, the spica. Okay, hold on. The spica will be under the number C.
Yeah.
Yes. Okay, so the rest, and then rest means off the activities that reproduce your problem. And then ice pack, and I always suggest ice pack at night. Ice pack at night. Reason very simple. The whole day you're doing chef cooking. Whole day you're counting patients. Whole day you're counting So at night, that's where your free time, a little bit of free time. Take something cold from the fridge and apply on your pain. Okay, ice pack, very frequent at night actually. Okay, and then what else you can do for inflammation? Decompress. You can wear a thumb support, or we call it thumb spica. Thumb support or thumb spica. All right, or another one is we call it stylish taping. Later we will show you next slide. Stylish taping. We tape you. It works like a spica. And then ultrasound. Ultrasound works for inflammation. Solumeric. Solumeric is my product. No, not really my product lah. Solumeric is a product that works for anti-inflammatory. Okay, because it comes from it is extracted from the turmeric. All right, and medication. Okay, worst come to worst, medication. If you are not breastfeeding, yes, you can go for medication. And I think your physio also can advise you for the medication usage. Advise you so that you can get from pharmacies. Physio don't prescribe medication, yeah? A lot of people ask me, hey Ben, so do you sell medication? Oh, no, I don't sell. Okay, Shuhui, do you sell medication?
No.
We don't sell, okay? We don't prescribe. Okay, we just advise you what kind of medication you should take. Anti-inflammatory group or muscle relaxant group, etc., etc. Yes. Yep. Okay?
Okay.
So,
Mr. Ben, someone asked, ice pack should be targeted at the outer wrist area or at the drumstick area. Also, for how long each time?
Oh, good question. All right. Normally, ice pack is meant for inflammation. Normally, ice pack is meant for inflammation. So if there's an inflammation and pain, outer area, you put it at the outer area. Okay. Now, ice pack theoretically 10 to 15 minutes. 10 to 15 minutes. All right. It could be shorter. Shorter, not longer. 10 to 15 minutes. It could be shorter, less than 10 minutes if it is cold enough. If it is cold enough. Okay. So ice pack at the pain area, targeted pain area, 10 to 15 minutes. Okay, no longer than that. Could be shorter, but not longer. Okay, as long as cold enough, you can take it out. How frequent? Every 20 minutes, or every 30 minutes, every hour also can.
Okay.
Okay, good.
Okay.
So what can BENPHYSIO do? Yeah, so just now we mentioned about the stylish tape, right? So now this is the tape that we try to use, okay, to mimic the function of the thumb spica, the where you wear for your thumb rest. Because with this tape, right, it still allows you to work. Our tape very special one, oh. This tape you can last for 2 or 3 days, and you can kena water, kena air one. Okay. So with water, you still can work. Okay, you still can wash your dish, wash your whatever, or rinse your cloth. All right, with this tape. But at the same time, it just reserves the function to restrict your thumb movement. Yeah, so this is a very stylish. Why I call it stylish? Because we have pink color tape only. Yeah, we use pink color tape, very stylish. Very pink one. Okay, and second thing, what does BENPHYSIO do, right, to help you to WhatsApp again? We will work on your thinner muscles. MFR is one of our technique, myofascial release. So we work on the thinner muscles. So, Suhui, what is thinner muscle?
Our drumstick.
Yes, our drumstick muscle. Okay, our thinner muscle is our drumstick muscle. There, this is our drumstick. This is our thinner muscle. All right, so thinner muscle, we work on your thinner muscle. We are manually work on your thinner muscle to loosen your muscles. Okay, so these are the 2 special things that we will do, okay, for the quervain syndrome. Okay, good. Next, what are the solutions?
Yeah, the tips that people been asking.
Yes. Okay, because why? I'm here today to listen to a solution, correct or not, Suhui?
Yes.
Oh, I want to know solution. Now, my solution very simple. My solution, that means BENPHYSIO solution, very simple. 3 simple self-help at home. Okay, number 1, stretch your thumb after any games. Okay, stretch the thumb. I think next slide. Okay, next slide. Stretch the thumb. There, pull your thumbs down. Pull your thumbs down. Okay, pull your thumbs down. Okay, my thumb, I pull it down. Stretch your thumb. Okay, so every time after your hard work, stretch your thumb. Hard work means what? After air stewardess counting for number of passengers, 1, 2, 3, 4, 5, I stretch my thumb. After I play my TPS4 for 1 hour, I stretch my thumb. After I wash this for half an hour, I stretch my thumb. After I pump breast milk for my baby for 1 hour, I stretch my thumb.
Your thumb.
Yes, okay, stretch your thumb. Stretching, hold for how long? 10, 15 seconds. All right, 10, 15 seconds. Yeah. All right, how frequent? Anytime, no? The more you do, the more you are. Okay?
No.
Because the more you do, the more loosen. Yeah, that's why the key word actually is every time after your workout, you do the stretching. It helps you better. Yes. Okay? So besides just now, the earlier we say eyes at night, more frequent. All right, this is how you're going to self-help yourself. Okay?
Right.
Yes, good. Now, second exercise. Second one. So, of course, you stretch your thumb already. Don't forget about your other fingers. Okay? The other fingers also quite important. So now, we teach you, stretch your 4 fingers. Stretch your 4 fingers. 4 fingers. 4 fingers. Yeah. Some people like to stretch downward. Some people like to stretch outward. This is up to you, lah. All right? As long as you are stretching your 4 fingers, good enough.
Forearms,
okay?
Muscles
yes,
well.
forearm muscles, 4 fingers. So number 1, stretch your thumb every usage.
Yep.
Number 2, stretch your 4 fingers, or we call it wrist stretch. Okay? And one more, number 3, the most important one, but sometimes it's a bit painful. Okay? Stretch your scar. Just how we say, there's a thumb, right? Now there's a thumb pain, there's a scar. Okay? So we have a test also, right? Just now we were saying there's a test. So this test, right, besides we use the test as a test, you also can use this test as a stretching. Okay, so now as you try to do it now, if you look at the step 1, right, comfortable stretch. All right, same thing, hold the thumb inside the 4 fingers. Okay, and then slowly bring your bring your wrist downward. Bring your wrist downward. Okay, so this is how you stretch your scar around the pain area. This is very useful. Okay, now, if some people ask me, hey, if I hold my thumb inside, I already feel the pain, how? So just hold there, lor. Don't pull down. Just hold there. Okay? When you're more comfortable, my pain is lesser, that's where you start to pull down. Okay? So this one, it has to be progressive one. You cannot straight away, okay, today I got a pain, today I straight away pull down. Tomorrow you will cry. Tomorrow morning you will cry. No? Don't too enthusiastic, okay, to stretch it. Yeah, go slow. Okay, take it easy. Because this tendon, no matter how you work on it, 10 to 14 days at least, it will heal. Okay? Yep. So I think basically all the solutions are covered. The solutions for the mother's thumb wasset syndrome are covered. Okay.
Actually, it's quite familiar, quite similar with the previous Facebook Live, right? That we talk about the self-help.
Carpal tunnel. Yes. Actually, it's the same one. Okay, let's put it this way. Most of the human body, right, is the same one. All right, same, but just like manifest in different pain. Okay, so now some people have asked me, hey, if this thumb pain, right, has been there for 1 year or 2 years and still not getting better, even though I see doctor, medication, physios, so what else? Okay, what else? So if it's not getting better, let me tell you, it's not a real thumb pain. It's not a real wasset syndrome. It's not a real the quervain syndrome. Actually, it could be a nerve problem. All right, a nerve problem. So so it's a nerve problem.
You mentioned, right? Like
yes,
in our previous
yes, our previous live, which is about tennis elbow. So everyone,
elbow.
So everyone can go and have a look at the tennis elbow side. Yes, okay, but you're not going to touch it here more here. All right, yes. Okay, so if your thumb is not getting better after physios, after seeing us, don't worry. There's another cause that can cause your thumb pain. Okay, this is the answer. Nerve problem. Okay, because nerve problem is another big story. So we're not going to touch here. Okay, and I think that's all. Yep. Yeah. So this one is next week. Yes, Shu-Hui, you proceed.
Just to update everyone that our live will actually be every Saturday, 4 p.m. Yeah.
Yes.
Saturday, 4 p.m.
4 p.m. Yes. And next week will be a very interesting topic. I myself will be personally conduct this again. Incontinence. Urinary incontinence. Yes. Okay. So hope everyone will come in again. All right. So because it's a very interesting topic. Okay. Don't feel shy. You are participating our FB live doesn't mean that you have incontinence. It's always good to learn. Yeah, it's always good to learn. Okay, because incontinence is not talking about leakage only. You also talk about sexual function. Yeah, we're gonna touch a little bit on the sexy part.
Sexy part.
Yeah, Shu-Hui, you feel excited or not? Okay. Okay, so stay tuned. Next week, incontinence. Hey, we're professional, ma. Incontinence is not only about the pelvic floor, the urinary.
Actually, it's quite a concerned topic for the population.
Yes. Okay. Yep. So if anyone has the problems, stay tuned next Saturday.
Yep. Every Saturday, 4 p.m.
Yes.
About the self-help tips, right? You can always comment slides. Okay, we will send out the slides to you. Okay.
Yeah.
And the last part they already mentioned about the question, right? To give for the free session giving out, physio session giving out. So we were going to repeat again one more time and we'll give some time for you to answer. Okay, to search.
1 minute from now.
Yep. So Mr. Ben, what is the answer?
So
the question. What's the question?
Yep. The question. The question for today is. Do you want to go back to the third slide? Sure. Oh, the question is, what is the other common name for the quervain syndrome? So what is the other common name for the quervain syndrome? All right, they are mother's thumb. You can call it wasset syndrome. Some people also call it Blackberry syndrome. texting syndrome. Yes. Okay. Yep. So
All
at
you
least
need to do
everyone
is
learn.
tag 3 friends.
Yes. At least everyone learned one thing today. I have outer wrist pain. It may not be my wrist. It could be my thumb. So
The
therefore, yes, your drumstick and causing your thumb pain. So therefore, when you buy the wrist brace, have to be careful. Are you buying for the wrist or are you buying for the thumb? They serve the different purpose. Okay, so we're going to end here within 1 minute's time. Right, Shu Hui? Yep, countdown, 30 seconds more. So everyone, if you need our slides, comment slides, we will send you the slide.
Yep, tag 3 friends and then got free session for you, physio session. So
yes.
Take this opportunity.
Yep. Shu Hui, can you open the online consultation page? So let the page last. So this is our new service. Okay, if you need help, if you not feel comfortable to come over, this is what you can do. Okay, so we have, that's all, time's up. Okay, goodbye Shu Hui, goodbye everyone. Akira, not the quervain disease.
Goodbye.
Okay,
Thank you, Mr. Ben, once again.
Okay, thanks. Okay, goodbye.
Thank you.
Bye-bye.
Thank you. See you next Saturday.
Yep.